Before going to the first part, let's take you a bit through this. Okay. So, in epidemiological studies, there are certain terms that you should know. One is incidence, one is prevalence, third one is odds ratio, fourth one is relative risk, fifth one is attributable risk. We will discuss all this not today, but next week. But before that, any epidemiological design, this is very important. You can take maybe you can take a screenshot of this if you wish. What are the epidemiological designs? The question is, what are the epidemiological designs that you know of? So you have basically an observational and experimental. So observational means it can be just descriptive. Again, descriptive can be two types, longitudinal and cross-sectional, and also it can be ecological. Observational also can be analytical, which includes case control and cohort, and that again could be cross-sectional. And the other one is experimental. You are doing an experiment. You are adding a drug, you are increasing the dose, there is some new technique, some laser technique, robotic surgery, etc., etc. That is the experiment. Clinical trial, field trial, and community intervention trial. So this is basically the sum and substance of the epidemiological design. Okay. So we will talk in details about this later. So the basic thing is today is a topic today is a cross-sectional study. Okay. So today we will talk about cross-sectional study. Okay. What is a cross-section? A cross-section is just a short of the present things. Now, for example, cross-section study just gives you nothing actually. Descriptive also gives you basically minimal data. But to go further, you have to proceed a bit further. For example, this is a cross-section of which batch? Which year are you joined? 23, okay. So I say 23 batch, maybe 50 girls, 100 boys. Is it of any use? 50 girls, 100 boys. I was giving an example, maybe more, maybe less. That is my cross-sectional study. I have got that feature, 50 girls, 100 boys. So I have to develop on that. Next thing is slightly something more. Maybe 50 girls of 100 boys. Now, how many of them, for example, came from West Bengal board? How many of them came from CBSE? How many of them came from ICC? That will be another classification. Again, another classification could be something else. Okay. How many of you, based on your marks in the HS or whatever, that could be another way. So you are breaking up the cross-section into various things. Just by getting my information of 50 girls, 100 boys will not solve the issue. But again, these are things which you need to do. So that is a cross-section and descriptive study. So cross-section collection of data and comprises of a sample or a whole sample of the population. Okay. Now, here's the problem. A cross-section of the population. You cannot take the whole population. Say, for example, I want to do a study of students in medical college. Study on, say, the internet use of among medical students. Medical students in Santiniketan Medical College. I don't have a time to do for all 5 batches. But I'll take you all as a sample. Okay, but at the same time, your thing may be different from your seniors or juniors. But this is a representative sample. I'm taking a third year, those who are appearing for part 1 exam, their internet habits. Okay, so that is one thing. So that's a sample of the whole population. Is it clear? So it's also called, cross-sectional study is also called a prevalence study. So here what we're saying is, number of existing cases, old and new, divided by estimated population at that time into 1000. Okay. Now I'll say, for example, what is the prevalence of myopia in this batch? What is the prevalence of myopia in this batch? How do I know it? How many of you are wearing spectacles? Maybe 25 of you are wearing spectacles. Just give me a guess. So that is 25 divided by whatever the population in 1000. That will be the prevalence rate of myopia, short-sightedness. Some of you may be wearing contacts, I don't know. Some may be having hypermetropia or something else. But this is the prevalence rate is number of old cases and new cases divided by estimated population into 1000. So as I said, observational study. You are doing a single examination of population at one point in time. It is individual based, measures exposure and effect, and exposure can precede or follow the effect. Okay. Now, so I'm just at one particular point of time, I'm doing the examination of the population and I examine all of you, for example. I just check the blood pressure of all the students. And I find that 20 of you all have a hypertension. Then some of you say, sir, it happened because I was, after coming to medical college, my pressure went up or I fell sick or this and that. So that is what they're saying, exposure and effect. Exposure precedes or follows the effect. Okay. So here you have a descriptive cross-sectional study, population survey, it's also called a prevalence survey, information about single or multiple variables. Estimate the problem and the prevalence. For example, any of you have submitted anything for the ICMR project? Anybody submitted anything for ICMR? তোমরা batch submit করেছে? ICMR project? ICMR research project? Nobody. Okay. Your junior batch had somebody, few people have submitted. One of the things which came to me was the stress burnout factor among ASHA workers working in Birbhum district. A burnout factor among ASHA workers working in Birbhum district in tribal blocks. It's not easy to get that. So what he's doing is, he's trying to get information about multiple variables and estimate the problem. How many of ASHA workers are having burnout? There is a criteria for burnout. So that is the way a description of cross-sectional study is going. He's just describing it. Okay. So here you see the presence of disease, disability and symptoms of ill health, dimensions of positive health fitness, attributes related to healthy body measurements, blood pressure, etc. Yesterday, for example, I was talking to one of my friends. She lost her husband and she's staying alone in Delhi. So what I asked her how she's doing her time, spending her time. So her daughter got married, daughter's expecting. So she said, I'm doing a lot of workouts. But I asked her, are you going to the gym? She said, not gym, I'm just walking for kilometers and kilometers. So she said she's walking about 10 kilometers with keeping the watch, so many steps, etc. So that is the positive health, that is fitness. Attributes related to health, body measurements, blood pressure, etc. Now, second is after that is the basic description studies, as I told you, how many boys, how many girls. Then comes the strength of association between disease and risk factors, determinants of disease and predictors of disease or condition. That is the analytical cross section. Now, for example, coming back to the example which I gave about myopia, 25 of you are wearing specs now in fourth year. By the time you finish your internship, maybe the 25 would have become 40. So that you can say that studying for another 1 year medicine make me wear spectacles. Okay, it's possible. Maybe more use of books, more use of net, etc., etc. So that could be possible. Determinant of disease, risk factor, and predictor of disease. Okay. So here you have to be important. The information you get and the strength of association and testing of hypothesis. Because actually this causes that. And sometimes you get what is called a wrong association. I'll give you an example. When I was posted in Pakur, in WHO, Pakur is in nearby Jharkhand. We had 8 cases of polio in the year 2010, and all India we had only 42 cases. So Pakur is a very small town, small district, and all the cases were located in a small area. So naturally, when the cases came, people started jumping in. People came from Delhi, from Geneva, etc. So one of the people from Geneva, he came and he was looking at all the data. So the data showed that all the 8 victims who got polio, kids who got polio, belonged to one community, minority community. That is one thing. Second thing was more interesting. All their mothers were working in the BD industry. They are making BDs. So he was saying that, is BD making a contributory factor to getting polio? I said, I don't think so. He said, maybe the effect of the tobacco is affecting the child and the mother during pregnancy, and that's why the child gets polio. I said, no, it's not that. It's just happened, it's a coincidence. But he said it's a very interesting observation because that area, Murshidabad, that Dhulian, that side, BD making is a major industry and most of the women do that. So, but it doesn't mean that there is an association between polio and BD making. Okay, that is what is strength of association and testing of hypothesis. What is a hypothesis, by the way? What is a hypothesis? What is the meaning of hypothesis? What is the meaning of hypothesis? Anybody? Hypothesis manataki. What is the meaning of hypothesis? Very good, assumption. Okay, assumption, you think that this could be the cause. Eta hote pare. Okay, so that is, you have got to prove it. Say for example, I say that a lot of cases of cancer have come. It has come due to mobile phones. You have to prove it. I can't just say that if I say mobile tower is here and 10 cases of cancer are in the vicinity, you have to prove it by some authentic records. You can't just make an allegation like that. You can't make a statement. That is called testing of hypothesis. Then attributes of cross-sectional study is that population studied must be comprised of survivors at a point or a period of time, and attrition may have occurred before the study. People may have left the study before you started the study. Say you were planning to do get 1,000 people in that area, but you got only 940 people because some people have gone to other places. And it also describes the association between exposure and disease simultaneously. Okay. Measures prevalence of disease in exposed and unexposed. You are getting the measure of the disease in both exposed and unexposed. And here the risk measurements are prevalence ratio and odds ratio, as I told you. But evidence for causality is only sensitive. You cannot prove that this is the cause of that. The cause cannot be clearly understood. And the last one is there is a selection. It is more prone for selection bias. That means you are taking a cross section of people. Like I'll give you an example. What is the cross section of people you would like to take for, say, an election survey? Okay. Let me give you an example. Election survey, you take 10 students. You say which party is going to win, this party is going to win, that party is going to win. Why are you taking students? Because they are educated. Okay. They may or may not vote. You take 10 people on the railway platform, may not be students, different groups, your figures may vary. What they feel may be different from what you feel. So that is why the selection bias is there. So you are having, let's get back to the basics. You are having a reference population, you are taking a sample, and from the sample, your characteristics of exposure and disease. And here, this is the outcome. Another outcome could be exposure and no disease. Third one is no exposure, but still the disease comes. And here no exposure and no disease. So 4 possibilities are there. Okay. So a person, for example, so that sample which you have, you should be able to get all these 4 categories. Okay. That is exposed to something and has the disease. Second one is exposed but no disease. His body mechanism is good enough. Third one is not exposed but still he's got a disease. And fourth one is not exposed, no disease. Is it clear? There's 4 things. You're all looking very blank. I cannot make out whether you are understanding or not. Have you understood this? Have you understood this? Have you understood this? Have you understood this? Yes or no? No. Yes or no? Kisu bolo? Huh? You understood? You understood? Okay. So I'll give you basically an example. Say 20 of you all go to for excursion somewhere, and all of you all go there, and when you return, you find that 2 people have got dengue, another 2 people who have not gone for the excursion had got dengue, and the rest of you all are okay. So 2 people got dengue when they went to, say, Duars. They were exposed to mosquitoes. 18 of you all, 16 of you all did not get dengue. I mean, among the group, 18 of you all who went in the group did not get dengue. 2 of you all who did not go to the Duars, stayed in the hostel, they also got dengue. Is it clear? Is it clear? It's not clear. Is it clear? I am just giving an example. 20 of you all went to Duars for an excursion. When you came back, 2 of you all developed dengue. So you all got exposed to mosquitoes and you got the disease, 2. 18 of you all went to Duars, no disease. But the other group, another 20 were here who didn't go for excursion. In spite of that, 2 people also got dengue, in spite of getting no exposure. Okay. They were sleeping under the mosari and mosquito nets, but they also got dengue. So that is the basic criteria of this cross-sectional study. Musveljo, have you understood? Yes or no? Yes or no? I still can't understand. This is very important. This particular part. Not everybody who gets exposed to a disease actually suffers from the disease. Not everybody who gets exposed to a risk factor gets the disease. So here there are certain steps needed in conducting a cross-sectional study. State the criteria for the disease condition clearly. Now this is something important. If I say that dengue is my study, I am studying the case of dengue among students, medical students who went for a excursion trip to wherever. So I have to say that it's dengue. Dengue means, is it for a clinician? Dengue is a clinical finding based on lab diagnosis. But as epidemiologists, we can rely on a working definition. Okay. So that criteria is there. For example, if you want to look at influenza, all cases of fever and cough are not influenza, but you cannot diagnose influenza also. So the certain criteria is there: fever, cough, malaise, etc. Influenza-like illness, that criteria, if it fulfills, you can take it as influenza. So the criteria for the condition should be mentioned clearly. Define the co-variables to be measured. Examine the ethical issues. Identify the reference population and inclusion-exclusion criteria. Okay. So when we are doing something, the third one is very important. Define the co-variables. What are you looking at? You are looking at the exposure of another of your students, another of your juniors, for example. So she's doing a study on effect of second-hand smoke. People getting exposed to second-hand smoke. That is, if there's a tobacco user, his family members, how are they getting the thing? That is what she's doing, is the co-variables are measured properly. Then the third one is examine the ethical issues. There are a lot of ethical issues. Sometimes you are maybe, if you're looking at a particular risk factor, instead of say you're looking at the risk factor of alcoholism and something else, violence, domestic violence. That you are seeing that the person is involved in so much alcoholism, he's become cirrhotic, he's involved in domestic violence, but you're continuing with the study. So there's an ethical issue involved. You're not stopping your study. Identify the reference population and the inclusion-exclusion criteria. Who are you going to include in your study? This is important. Define minimum number of samples required. How many people do I need for a study? Okay. Now, I want to do study. There are certain formulas there. 4 PQ by L squared. What is sample required? Then, how do I test this? How do I get the sample? Suppose I call all of you and tell you to take part in a study. Good enough. But some of you may say, sir, I won't take part in the study. I won't take part in the study. Fine. So that's what we do, a lottery system. Okay, so that there's some elimination of bias. So some people, they may be very good in studies, we take their opinion only. Some people may not be that good, their opinion also matters. So that's why select study subjects through appropriate sampling method, usually a lottery system, okay. So that anybody who picks a lottery, he will be selected in the as part of study. Define measurement procedures. This is again important. Why is the defined measurement procedures important? Why is defined measurement procedure important? Well, why is defined measurement procedure important? Why is it important? Huh? No, don't. They are not confounded. Confounding is something another term. It's a very important different term. Just simple thing. Define measurement procedures. It's very important. Very simple but very important. Huh? Error chole aste. Give an example. Give an example of error chole aste pare. You said measurement. Define measurement procedures. Any measurement that you know of, that you do or you have seen, you must have done it in your first year or second year. Any measurement procedure? Huh? Any measurement procedure? Yeah, blood pressure. Okay, now you said blood pressure. Now tell me, blood pressure, tell me the procedure, measurement procedure. Tell me the measurement procedure, tell me. Just tell me the measurement procedure. Tell me in English. Bangla if I am not. So that is the thing. You tell me. That is what I said. You have to define your how you are going to take the blood pressure. Is it on the left hand? Is it going to be the patient going to be lying position or the supine position? Sheta identify korta. Okay. So whatever procedure you are doing, that has to be clearly, measurement procedure has to be identified. For example, another example is if you are taking the hemoglobin, blood hemoglobin. How are you taking it? What are you looking at? You are looking at the CBC and also hemoglobin using this material, this machine or whatever. Okay. So that is why the measurement procedure has to be clearly mentioned. Is it clear? Measurement procedure has to be clear. If you are looking at bilirubin, liver function test, or if you are looking at say ultrasound, what is the criteria? So then carry out data collection and clinical examination or laboratory investigation. So I think this part is clear to you. So define the minimum number of sample, select study subjects through sampling, define measurement procedures, carry out data collection and do the clinical examination. Then look at the clinical records and other data also if you are doing that sort of study. Interviews and questionnaires. Now here is something which is very difficult. Nowadays of course we have Google form, but previously we had a face-to-face interview. How face-to-face interview, the problem is that there may be some questions which, what are the problems in an interview? What are the problems in an interview? What are the possible problems in an interview or a questionnaire? Well, firstly, what is the difference between interview and questionnaire? What is the interview? What is the questionnaire? What?
Written and verbal.
Written and verbal. Which is written?
So questionnaire
is written. Very good. So question is written and interview is verbal. So what is the advantage or disadvantage of verbal? Verbal ki hai. You ask somebody something, the question may be slightly tricky, that person may not refuse, may not answer your question. Okay. You give him a question in a question form, he may give the correct answer, provided it's anonymous. Okay. Get my point. For example, you ask somebody, the question is, do you drink regularly? Do you drink regularly? That's the question. Regular definition, that is another thing. If you ask the question, no, but if you give it in the written form, he may say yes. Or any other question for that matter. So interview is one thing. Interview is, you have to get the persons. What do you need in the interview? What is required in the interview? You need? What do you need in the interview? Why will the patient tell you what is his problem? Why is it important? Why will he tell you that? Bola? Why should the patient or any person tell you something in an interview? What are generally you need something? You people went to the field, right? So you went to the field, you took photographs and all. So what was the experience? You took the persons, you had an interaction with the person, right? So you took the person into conference, he told you a lot of things. That is required. In an interview, you have to take the person into conference. Okay. So then only will he say, you just go to a person's house, hey, give me this data, I'm fill up, he will not answer. You have to spend some time with him, then only he will give it. Questionnaire on the other hand, dada eta fill kar, and he'll probably fill it, he'll just randomly mark without looking, without doing. And so that's the difference between interview and questionnaire. Then analyze and interpret findings and report. So here you have interview and questionnaire, summarize the data, analyze and interpret finding and report. So again, analysis of data in cross-sectional studies. You measure, this is a descriptive cross-sectional study, you look at mean, standard deviation, median and percentiles. Okay. For example, if I look at the height and weight of your students over here, I will get so much height. Average height of say so many centimeters to so many centimeters. Look for the standard deviation, look for the median height. Similarly, the other one is the nominal data, prevalence rates and proportions. So 95% of the confidence limit. What do you mean 95% of confidence limits? 95 means 95% of the population will come under this group. That is the thing. Okay. Now comes the big problem. This is the basis of nominal data. Exposed, not exposed, disease present, disease absent. This is a 2 by 2 table which is there in every single study of yours. Incidence, you have exposed to risk factor, exposed to disease. So here, how many people have the disease? Can you tell me? How many people have the disease? How many people have the disease? A plus C, very good. A plus C have the disease. How many people don't have the disease? B plus D, okay. So how many are exposed to the possible risk factor? How many people are exposed to the possible risk factor? You don't say. How many people are exposed to this factor, possible risk factor? Huh? How many people are exposed to the possible risk factor? Bola? A plus B. How many are exposed to risk factor and have the disease? Exposed to risk factor and have the disease. Okay. How many are exposed to the disease, exposed to the risk factor but do not have the disease? C or D? Exposed to the risk factor but, no, is it B? Exposed to the risk factor but do not have the disease. Exposed to the risk factor but do not have the disease. Bola. B. Exposed to the risk factor but do not have the disease. B. Okay. So this part is clear. So total number of people who are exposed to the risk factor is total number of people who are exposed to risk factor key. Total number of people who are exposed to risk factor. How much is it? How many people are exposed to risk factor? Total people. Huh? A plus B. Very good. And how many are not exposed? C plus D. Okay. So disease is present in? Disease is present in? Oh. Disease? A plus C. Disease absent in? B plus D. Okay. So this part, get this in your minds very clearly. This is the basis for your calculation. So we will go into the details in the next class, but some common applications of cross-sectional studies are community healthcare, in clinical practice and patient care, and in program evaluation, and in acquiring new knowledge. These are the common applications of cross-sectional study. You are doing a study on, in fact, some of the changes in the MBBS curriculum came because studies were done among students. Okay, so program evaluation. It's still an ongoing process whether the present MBBS curriculum is good enough or do we need to make changes. Acquiring new knowledge. So here you have somebody mentioned confounding. Who mentioned confounding? Who mentioned confounding? Somebody from this side mentioned. You mentioned confounding. Did you mention confounding? I don't remember. Anyway, so the biases in cross-sectional studies, your choice of sampling frame. Okay, how you have taken the choice of the people. Now, I'll give you an example. If you want to do a study on, say, health problems of a block in Birbhum district, you go to one village, you take a sample. Good enough? Right? Yes or no? But you go to another village, which for example is a very poor village or not a very economically well off, or they have a lot of massive Adivasi population. Will the sample results be different among this population, that population? What do you think? You are taking one village near your house, near your college, say Muluk, and you are doing a sample from there. On the other hand, you are taking another sample from a block, from a village which is quite far off, but which has got some very poor people who are, who are a majority of tribals. Do you think there will be a difference in these two? Huh? Do you think there will be a difference in these two samples? Yes or no? Yes or no? Kichu eta bolo. Okay, Mr. Samastipur, you tell me. If you take a sample in front of your house of patients in the Dalsing Sarai and compare it with Patna, will there be a difference? Hai ki nahi? Yes. Why? Why will there be a difference? Huh? Or I take, for example, somebody in Darjeeling, if I take a sample, and somebody in, say, Birbhum, will there be a difference in the criteria, in the thing? So that's why sample population, the health problems can be different in different places. Okay, that is what is sampling frame, choice of sampling frame. Second one is non-response. Non-response is the questions are in such a way that the person may not want to respond. Okay, like for example, some personal matters, say alcoholism and domestic violence. You ask the person, you ask the woman, does your husband drink? She says yes. Next question is, does your husband beat you after drinking? Who will answer that? So that will be non-responder. Okay, that is what is non-response. So there will be some questions which are rather tricky and which there will be no response. Third one is information bias. Information bias is something which people try to say, but they may not say. Like for example, he may, if somebody's got dengue, he'll remember that he's got dengue. He'll say that after he went to Duars, he got dengue. But another person who went to Duars, who has not had dengue, he may not mention it. He said, no, I never went anywhere. He also went the same bus with them to Duars, but he will not mention it. That is information bias, informant bias. Okay. Fourth one is observer bias. So observer bias is something which is also called observer bias is something which, like, you are observing certain things and the person knows you are observing, so he corrects himself. Okay, you are seeing a person who's always asleep on duty. So, but once you see him, he'll suddenly open his eyes. I'm awake. That is called observer bias. And last one is prevalence bias in hospital studies. So this is again, who are the people who come to hospital? They are obviously suffering from some illness. But when you take another group, we'll talk about this in details next class. It's a bit, at this class you may not be understanding. There is a prevalence bias in hospital studies. So if you take people with one disease, fine, but the other group may not be, that is there in the case control. The other group also may be having disease for which they have not been diagnosed as yet. That is the prevalence bias in hospital studies. Advantage of cross-sectional studies is again a common question which is asked. Provide estimate of the disease burden, that is prevalence. Relatively short duration, you don't have to continue for a long time. Easy and quick, less costly, useful for chronic conditions with low case fatality. So chief advantage is You know the estimation of the disease, relatively short duration. You don't have to extend it to for months or years. You just take a cross section. Easy and quick, less costly, useful for chronic conditions with low fatality. Just for example, your own family care project. That is an example of a cross-sectional study. What you're doing? You're providing estimate of disease burden, short duration, easy and quick, less costly, useful for chronic condition with low case fatality. Okay. Disadvantage is that it does not show you the true disease occurrence. There is no direct estimation of the risk also, and rare disease or short duration disease, high case fatality, not detected. Natural history of information, disease information is minimal. Okay. So you're just taking a cross-sectional study, you're not getting this data. That is, does not provide estimate of disease occurrence, no evidence of actual risk, rare diseases and short duration, with disease with short duration cannot be detected, and natural history of the illness is minimal. Okay. And it is prone for biases and from selective survival, and it's not possible to establish temporally what is the cause. Therefore, it is actually a weak design. So, cross-sectional studies in actually a weak design, you need to intervene or do a follow-up or something. Okay. So, it's a weak design for proving the cause. So, you have other things also. When you don't have time, this is the best thing. Rapid epidemiological assessment procedures, and simple, inexpensive, but gives you an idea for your program estimates. Okay. It may not be accurate, but gives some idea. And useful emergent situations for appraisal of health needs. You cannot have a study which goes on for 5 years or whatever. Okay. So it's a fast thing. So example is coverage evaluation survey in EPA, expanded program immunization, cataract survey by trained paramedicals, identification low birth weight by trained birth attendants using color-coded weighing machines. These are examples of cross-sectional studies. You are just doing a cross-section, you don't understand, you're looking for the cause or anything. You're doing what is the coverage evaluation of EPA, expanded program immunization. Then what is the prevalence of cataract by trained paramedicals? Then what is the prevalence of low birth weight by trained birth attendants using color-coded weighing machines? Okay. So now this is a study which I showed you in the previous class. 1,000 people above 30 years were examined for looking at blood pressure, and their blood pressure is diagnosed, and the data is as follows. Now take a look at this data. Total number of cases, how many? Total, how many people are being studied? Total, how many people have been studied? How many people have been studied? Totally, how many people have been studied in this group? In this group, Kaujan, dekhte bachcha, pichhe dekhe? How many people have been studied? No, sorry, I have not. How many people have been studied in this group? Total, how many people have been there? Studied? Bolo. Total, how many people have been studied? Bolo. You have to take it, bolo. How many people are there? How many people are there in the study? How many people are there in the study? Dekhte bachcha. How many people are there? Huh? Yes? Bolo. You said somebody gave the correct answer. Bolo. How many people are there in the study? How many people are totally in the study? Bolo. Yeah, 1,000. 1,000 people are there in the total study. Now you tell me, how many people are there who are smokers? How many people are there who are smokers? Present smokers. How many people are there who are present smokers? Huh? How much? Bolo. Present smokers, how many are there? 400. How many non-smokers? 600. Okay. Now so the disease is hypertension. How many have hypertension total? How many people have hypertension? Bola. So out of 1,000 people, how many have hypertension? How many have hypertension out of 1,000 people? 150. Okay. How many of the how many are smokers of the 150? Among the 150 who have hypertension, how many are smokers? 120 smokers, 30 non-smokers, 150. Is it clear? And hypertension is absent in how many people? Total, how many people is hypertension absent? 850. And among them, how many smokers is hypertension absent? They smoke, but they don't have hypertension. How many of them? 280. And who have not smoked and who are not hypertension, how many is there? 570. So is this clear? This picture is clear. Is it clear? If you want, you can draw it yourself. Now comes the next part. So this part, everybody is clear? Is it clear to everybody? Shall I must say? Yes or no? Only then I can go to the next part. That side. Is it clear? Last bench I can't make out. Is it clear? That side. Is it clear to you all? Clear, okay. So what is the prevalence of hypertension among smokers? Prevalence of hypertension among smokers. So how many people are smokers and how many have hypertension? So there are 120 divided by 120 divided by how many? Among smokers, how many of them have hypertension? Bola? Among smokers, how many of them have hypertension? First is how many smokers are there? Total? Total how many smokers are there? 400. Out of which how many have hypertension? 120. So 120 divided by 400, or that is basically A by A plus B. So that gives cases among exposed 0.3. Okay. Similarly, what is the prevalence of hypertension among non-smokers? So in spite of non-smokers also you have hypertension. So what is that? So you have 30 people who are non-smokers but they have hypertension, non-smokers who have hypertension, and the total number of others also who are non-smokers are total number 30 people who are non-smokers have got hypertension. And what is the other percentage? The people who have not smoked and who don't have hypertension, how much is that? The people who don't smoke and don't have hypertension, 30 don't have hypertension and 30 have hypertension but are non-smokers. Total number of non-smokers koto ache? Total number of non-smokers, how much is it? Huh? 600. So 30 divided by 600. So prevalence of hypertension among smokers is 120 by 400, which is 0.3. Among non-smokers is 0.05. Okay. Is this part clear? It is clear, Ajay? Is this clear to everybody? Yes or no? I'm not very confident. This is there in your books. Please refer to your books, or you can take a photo of this if you still can't understand. I'm willing to pause a bit for this. So then you have what is called the prevalence ratio or odds ratio. So prevalence among exposed divided by, that is called the prevalence ratio. Prevalence among unexposed, that is 0.3 by 0.5, that gives you 6. On the other hand, we have what is called odds ratio, AD by BC. Now you just remember AD by BC. We'll talk about this in the next class in detail. AD, what is A? A is 120, D is 570. 120 to 570 divided by 280 to 30. That gives you 8.14. Which means it has a high, the chance of smokers having hypertension is very high. Okay. So here basically some of the things about cross-sectional cohort and Other studies, cross-sectional studies, not good for rare disease, not good for rare causes. Multiple effects, yes. Multiple exposures, yes. But anything else, we can't do anything. On the other hand, case control and cohort study has got more things, but they have their own problems also. Okay. And so this is the same. So here again, the different cross-sectional studies, you have medium selection base. Recall bias is quite high. Now, what is recall bias? What is recall bias? When you take a history of a patient, you ask the patient what the past history, right? Yes or no? Aage kono oshok hoyechilo? You ask the question, but he may not remember. He may say, "I fine, he might forget." Like for example, somebody comes with pain in the leg, and or he's not pain in the leg, he comes with some neurological problem. But we think it's a neurological problem. But somebody who's pretty smart in your batch asks, "Apnar aage kukur kamne diyechilo?" He's thinking in that line, could be rabies. Okay. So, but he's asking that question. But that person doesn't know kukur kamne diyeche, lick koreche. He doesn't know. He doesn't know the dog has bitten him. So that is called recall bias. So if you say that somebody's got cerebral malaria, you ask him kono jagah badate geche, he will probably not recall. He said, "I'm morning," but he's actually gone. Not morning. That is called recall bias. Loss to follow-up is not applicable in cross-sectional study. Confounding factors are medium. Time required is medium and cost is also medium. Okay, so we'll stop now for today. Next class we'll continue. Okay, thank you.